Trauma-informed CBT is an oxymoron. It is not possible to conduct cognitive behavioral therapy in a way that is truly trauma-informed. I understand there is the existence of TF CBT, which is a 15-week manualized program which is supposed to relieve people of their trauma symptoms. And maybe for a little while it does, but not over the long term. What people really need in response to trauma, and in this particular instance I'm referring to PTSD and CPTSD. I want to point out first that I think that there's a false binary between these two things. There's very few people who don't have CPTSD who have experienced trauma. In addition to that, the things that somebody who has experienced CPTSD really need in a therapist, somebody who is willing to provide a secure, predictable attachment over time, somebody who is able to tolerate the emotions and affect that come with the trauma as it's being explored, if it's explored, and if that's what feels most comfortable to the client. The therapist is supposed to be able to provide what is called corrective emotional experiences, which basically help the client to rewrite what's happened to them in the past by offering them enough experiences with the therapist over time to make them to believe that attachment can happen without harm, without destruction, and without annihilation. In order to process trauma, we need to feel. TF CBT focuses on having 1, cognitive distortions, and 2, problematic core beliefs. The thing that survivors need the most is to be believed. So if you start to question your core beliefs in the presence of a professional, you're already reenacting the trauma. You're already in the place of sitting with an expert who doesn't believe you and is helping you to not believe yourself. And in terms of cognitive distortions, the best thing that somebody who is a trauma survivor can do is make peace with the thoughts and feelings that they have in their own mind, and to know that those thoughts and feelings will not hurt them over time, and that they are not a threat to themselves just because of what they've experienced and how scary what they experienced was.